Good afternoon from Hans Seidel Foundation, India. Today we're talking about Sri Lanka, and as you could already hear by Professor Uyangoda, it's a highly interesting topic. This is an online discussion series where we take a closer look on decentralizing processes in Asia and the respective institutions responsible for implementation of decentralizing governance. We analyze the structures with a particular focus to the COVID-19 crisis. This is a part of the larger global programs of the Hans Seidel Foundation on federalism. Today's topic is called Collaborative Governance Responses to COVID-19 in Sri Lanka. As always, we'll be talking about the pandemic and the response by the local and central governance of the country, in this case Sri Lanka. But as always, also we're looking at what is the situation of decentralization or devolution in Sri Lanka.
So our topic today is, of course, how different levels of government have been working together in Sri Lanka, including private and not-for-profit sector, in managing the negative impact of the virus. So first of all, I would like to give the floor to Professor Jayadeva Uyangoda. He will be, let's say, introducing the concept of power sharing in Sri Lanka. The objective of his presentation is neither to justify nor to falsify that several institutions and processes in Sri Lanka are working well or are not working well, but to try to bring issues and debates surrounding how those power sharing activities and evolution of different concepts of government and governance is in Sri Lanka have been working for quite a long time.
Now, one of the things that has happened when the corona pandemic broke out in Sri Lanka in late February, early March, was that a new argument for re-centralization of Sri Lanka's state and administrative structure had emerged in Sri Lanka's political debate. The new president was elected in October or November 2019, and the president's election campaign basically focused on the question of national unity, national sovereignty, and national security.
So within this framework, the question is, where does health feature? So healthcare is generally understood as falling within the devolved list or the provincial list. That means it's within the jurisdiction of the provincial council. Provincial health authorities are supposed to do most of the work to ensure people access high quality, affordable healthcare services. But then, of course, you have the more direct domain of controlling interprovincial spread of infectious disease. And this is more directly relevant to the COVID-19 crisis. And this particular subject, the controlling of interprovincial spread of infectious disease, happens to be a concurrent list subject. So that means both the center and province can legislate on it. And if the center passes or wishes to pass a new law, it is meant to consult the province before going ahead. So this tells us that the COVID-19 crisis falls within the domain of the concurrent list, and it is the quintessential example of where the center and the province must collaborate to deliver effective and efficient solutions to the crisis.